Hello everyone, welcome to an episode of TooHealthTalk, a show where we talk about medical challenges and I'm going to break it down in a very simple and honest conversation. On today's episode, we have a very special guest, two special guests. We have from Zainab and we have Dr. Abdulrahman, and we're going to be speaking on a very important and delicate topic today, which is bilateral tubal ligation. This topic is a very sensitive topic. That's why I had to bring two giants. Yeah, this is the first time I'm having two in the show at once, and I'm very excited that you both honor our invitation here. So, over to you, Dr. Abdulrahman. Welcome to the show,
Thanks,
and Zainab, welcome to the show.
Thank you for having me.
Yeah. So, Doctor, can you explain? Can you give a breakdown of what tubal ligation is?
Okay, so normally it's called bilateral tubal ligation, meaning basically it's a surgical procedure in which we doctors cut off the portion, the fallopian tubes. We can cut it off or we can twist it so as to prevent fertilization, so as to prevent pregnancy, right? So it's a in the modern world, it's a laparoscopic procedure, meaning that we make a small cut in the abdomen. It's a very small cut, maybe as long as this part of my finger. And when we get in with instruments and we essentially block the pathway so fertilization cannot occur. And it's mostly done for women who have completed the family size and they've made a choice. When I say it's done for women who have completed the family size, I'm not saying it's 100% permanent. It's also reversible should you choose to want children in the future. So basically, that's the definition of bilateral tubal ligation. Bilateral means both sides. Tubal ligation means cutting or twisting of the tubes where fertilization occurs.
So this is basically talking about mainly about like family planning for women.
Correct. Yeah.
So now, is it that safe?
It's very, very safe, 100% safe. It's with the technology we have today, the post-operative complications are very minimal, and there are a lot of factors. We have age, family history, genetic history, but it's very, very safe. It has a has a failure rate of less than 1%. So that means in a population of 1,000 patients who had this surgery, less than 10 patients will fail, will get pregnant, which is a very good number considering all factors. So, yeah.
What about the recovery process?
The recovery process is very fine. It's not complicated. It can go from a few days to a week maximum. You may experience Patients may experience mild abdominal pain, bloating, and that's basically it. Nothing serious. Nothing serious.
So, like, how is it? Is it that effective than taking normal pills and
Very, very.
like pharmacy?
Yeah, it's quite effective.
So you think like you should be able to advise people that have finished giving birth to go to this surgery than taking medication?
Well, it's a matter of choice. It's a matter of choice.
Oh, okay.
Yeah. You lay down the options and the patient chooses what's convenient for them.
So which one is more safer, doctor?
All of them are safe. It's
taking like those pills and
okay.
Going through the surgery.
So with the pills, they act on your hormones, right? While this surgical procedure does not act on your hormones. It's very, I want to say mechanical, because it's like, imagine there's an express, you establish roadblocks, nothing's coming in, nothing's coming out. That's the end of the day. That's how bilateral tubal ligation essentially works. While for taking the pills somehow trick the body into believing that the woman is pregnant, when in reality she actually isn't pregnant. So the pills is more of a hormonal manipulation, while the bilateral tubal ligation is just a mechanical block.
Is there any side effects from this surgery?
Little to no side effect,
Because I know like taking these pills, taking pregnancy pills can cause a lot of damage. I saw a comment when someone was saying that because of taking like
contraceptive.
contraceptive, instead of
Yes.
having clots on her brain, blood
Yes,
clots on her
yes,
brain, and stuff
yes.
like that. So you say that okay, if someone has finished giving birth now, the best option is to do.
So if someone has completed family size or has chosen to finish giving birth, it's an option that we strongly suggest. But different people present differently and they come in with different backgrounds. So if a patient has maybe a blood disorder, I wouldn't suggest it because you're going to treat the patient, you're going to treat the complications more than the actual procedure because you're handling a blood disorder, hemophilia, and everything. So it's very tricky. It's not one size fits all. So that's what you have to look at.
Okay, now
So you see,
so comparing BTL to vasectomy, how effective it is.
both of them are very safe and effective. The only difference is the gender and the anatomical structure. For bilateral tubal ligation, the anesthesia which is used to sedate the patient is general. So the patient goes in and they just sleep, wake up, procedures done. For vasectomy, in most cases, actually in almost every case, the anesthesia is local. So you are alive, like you are not asleep during the procedure,
Mm.
and that's the major difference. But the aim is the same. It's the same aim to complete family size to prevent any form of pregnancy. So
So what's the difference between BTL and OCP?
okay, so BTL in most cases is what we suggest or what we give, what we encourage people who have completed family size because it's a surgical procedure and most patients are scared of surgery. Whenever they hear surgery, they back out, right? So it's encouraged after patient completes family size and if patient can actually do the BTL. That's number one. Number two, BTL does not interfere with your hormones. Like I said earlier, it's more of a blockage, of which is reversible. But OCPs, also known as oral contraceptive pills, they trick the body in a way where they manipulate the hormones and they make the body feel or believe that it's pregnant. So in one aspect you have a roadblock, in one aspect you have hormone manipulation. On both of them they achieve the same result. However, the side effects are different. For OCPs, one of the side effects can be clot and also breast cancer, which is quite high.
Oh,
Yeah, and no, we don't want that. And so as a medical practitioner, you really need to measure what's best for the patient. It's never a one size fits all situation.
so you're encouraging bilateral litigation.
I If the patient has completed family size, if the patient is fit for the surgery, and if the patient is actually willing to to do the surgery.
So now, how when it comes to this surgery aspect of family planning, like what is the effectiveness? Like when you compare vasectomy for men and bilateral litigation for women, like what's the effectiveness?
So the efficacy, the effectiveness is both of them are very efficient. Different literatures have different percentages, but the most common one is 40 to 85%, depending on different factors. For example, a 20-year-old male who had a vasectomy is going to have a higher chance of fertilization because he's 20 years old. He's like a really small kid compared to someone who's 85 for the male gender. For the female gender, it can also be the case, but you have to really look at different types, different backgrounds, maybe genetic factors, hormonal factors. We've also seen cases where there's a procedure was done, and the woman gets pregnant even after bilateral ligation.
Wow.
So it's nothing is ever 100%. You just try to reach 100 as close as possible, and you put in a lot of positive factors to help with the outcome you want. Nothing is actually 100%, but it really, really helps. Like I said, less than 1%.
So now, still on vasectomy now, like, if okay, they are trying to say, okay, men should do family planning, women should do family planning. Now, as a medical practitioner, now if you're giving, okay, the one that is like more efficient, more effective for like the general well-being of, okay, let's do family planning. Which one is more easier? Men should come out, because like I've seen people talk about that. Oh, when generally we're looking about family planning, women.
Focus on the woman.
Yeah. So now, if I'm talking to the audience, like, okay, as a woman, you can do bilateral investigation and get your get yourself done with taking medication every month, just to, like, and it's easier. People say, oh, why wouldn't I take the man to do vasectomy?
So, to answer your question, the problem is rooted from social cultural stuff, right? Because in this part of the world, at least, whenever there's a problem with the family, it's almost always looked upon the wife, the female or the wife, as the problem, right? It's very common to see a newly married couple trying to have a baby, and the first thing everybody asks is, why would the wife go to the hospital? It's never why wouldn't the husband go to the hospital, but the husband and the wife are supposed to go to the hospital together, because there's also infertility in men as there is infertility in women. It's very common and rising actually because of our diet and lifestyle. So if we can raise more awareness about the whole infertility stuff and encourage men to go to the hospital, get checked, understand what's going on with themselves and their sperm, perfect. But in my opinion, I would encourage both husband and wife to go get checked. It's never a one-sided situation. It's always good to have a full picture. So,
So if you're encouraging family planning now, your own personal experience now, would you encourage men to do family planning?
100%. 100%. Man, vasectomy, woman, BTL.
So you're not saying,
Enjoy
okay,
your children.
the women should not go to this surgery. Like,
Yeah,
women
they
should not
shouldn't bear it all. What I'm saying is they shouldn't bear it all. If husband and wife decides, okay, we have 3, 4 children, and we're happy with 3, 4 children. Now is not the time to raise other children. Man, vasectomy tomorrow. Woman, BTL tomorrow.
So both of them should just go to the surgery room. The one that say,
Till death do them apart. They marry together, continue together.
It's very fair.
it's very fine
Very fair.
for women. Oh, well,
Yeah,
some
because
people.
I've heard of I've heard of stories where you see the wife visiting gynecologist for years and it's infertility. Now for her to convince the husband to come for a visit to the urologist, who is like the gynecologist, the male gynecologist, let's put it that way, the male gynecologist, it's war. It's absolute chaos. They need to book, cancel, hopefully book again, recancel, and it's like a game of Tom and Jerry.
Yeah.
And it's really, really sad.
Yeah, man, like, do you know the reason why men are like this?
Ego.
Go ahead. There are among many
Masculine
others.
ego.
Well,
No, I mean, it can be because of many reasons. One, men don't enjoy being weak. That's one.
That's basically the masculine ego,
Some
right?
some will call it ego, right?
Yeah.
so Dr. Frank, what's your, like, view on that?
He should go. It's not a matter of, choice. He has to go. He has to.
Because it takes two to tango.
Exactly.
So, okay. I think people will just have to understand. So if I'm going to do vasectomy, my wife should do bilateral
But that's not super.
It should be a choice between. It should be a unanimous choice between two parties. It's not.
So it's not okay that, okay, as a man now, because I saw some people dragging men on TikTok that, oh, so men can do vasectomy and they're asking us to take pills.
I don't
Now,
know.
so
Men can do vasectomy.
men can do vasectomy.
Women were saying that.
Yeah, so women were saying, oh, so a man can do vasectomy and they're allowing us to take pills. And now they're saying, oh, for a man to do vasectomy, the wife should do bilateral tubal
In my own
ligation.
opinion, I think so, yes,
So
because
both of them should just go and do the surgery.
Of history.
yeah, enjoy raising your children.
But someone was asking when someone like saw the video of accessory, someone was asking, will you do vasectomy? I think that should be the first date question these days. Like, okay, will you do
Will you do
vasectomy?
Asking it as a first date question, I think it's pretty far because step one is getting together. Step two, having children. Step three, vasectomy
But there are
after having
couples
children.
where
But it's a free
they
world.
don't want to have children at all.
No.
Yeah.
So both of them just get to cuts. Yeah, stuff. So now, so what's the going back to BTL? What's the like misconception about it in Nigeria?
People think it messes with your hormones, like I said before, but it doesn't. That's one. Two, Nigerians especially can stigmatize you because they won't really know what happened or they won't really listen to explanation. They'll just believe she had a surgery regarding her womb, regarding her children. And that's the headline. And that's how to just keep on passing on again and again. And A will tell B, B will tell C, D, E. By the time it reaches X, Y, Z, the message and the translation and the chain of transmission has lost true meaning. And
For this stigmatization, I've had where they said like a woman removed her womb.
okay.
So when a woman removes her womb, I don't know if that's correct. If that's correct, what's the difference between a woman removing her womb and bilateral litigation? Yeah.
Okay, so now you're going deep into medicine, but no problem. So the womb is where the baby stays, right? The womb is where you have the implantation and where the growth, where there's pregnancy and where growth happens. Fallopian tube is where fertilization happens, right? Fertilization happens in the fallopian tubes and attachment happens in the womb. We, by BTL, bilateral tubal ligation, locks or twists the fallopian tubes. So no fallopian tubes, no fertilization. No fertilization, no pregnancy. No pregnancy, no attachment to the womb. No growth in the womb. So you cancel A, there won't be any Z.
Because some people get to mistake, oh, when they get to hear that, oh, a woman did BTL, they'll be like, oh, she has removed her womb.
It's
Like, I've had that several when it was like, oh, she did BTL, she can't give birth. Like, even though, oh, she don't remove her belly. So, like,
it's a bit exaggerated, but in scientific terms, she has her womb. It's not active because there's no fertilization. The use of the womb is to maintain fertility, to have pregnancy. But where the site of fertilization has been impaired, we can't have pregnancy.
So, Fran, do you believe that women should do BTL? Like, it should be like one of the like contraceptive for women for family planning.
Well, it's like I said earlier, it's about autonomy and choice. A woman should be able to choose what she wants to do with her body. Okay? If she feels it's safe for her, and if based on the doctor's recommendation, it's safe for her system, then why not?
Okay, so before we go, the last question: do you believe that men receive fewer barriers of vasectomy than BTL?
So there's more awareness regarding BTL compared to vasectomy currently, because for women, they have, I don't want to say they have more options, but they can choose to have oral contraceptive pills. They can choose to have implants, and they can also choose to have bilateral tubal ligation. So they have like 2, 3 options to choose from, each different in terms of invasion and procedure. But for men, apart from vasectomy, last time I checked, maybe there's a new one. I heard they're making a tablet a male birth control tablet. I think
Wow.
last 2 weeks, right? So if a man takes a tablet, it won't mess with his hormones. Everything will be fine. Testosterone levels will be perfect. Nothing to worry about, and he won't have to worry about any child, any pregnancy after the activity. So with that question, it's more of a socio-economic, socio-cultural aspect, and I think it's shifting slowly, but definitely shifting. So eventually, we're going to have meals, we're going to have tablets, we're going to have more options to explore. Should we not want a vasectomy?
So for now, I've had people say if a man gets to do vasectomy, he's no longer a man. Is it the same thing for a woman? If a woman gets to do bilateral tubal litigation, is she no longer a woman?
No, that's totally wrong. It's a misperception from people. It's totally wrong. Still a woman. She still herself. There's nothing changes really apart from being able to have babies.
Okay, thank you for this insightful conversation. So, lastly, Doctor, just a wrap on BTL. Like, what's a general overview, your general advice on BTL to our
BTL,
viewers?
I think, it's a really good option for families who have chosen to complete the family size, and it's not as scary as people make it to be. Like what I suggest the viewers is, whenever you hear something, never Google it because Google is horrible.
Exactly.
Right? Because Google will tell you died yesterday.
Mm-hmm.
It's really bad. That's one. And two, it's just like any procedure. You get in general anesthesia, you get in, you lie down, sleep, wake up, boom, and you'll be well taken care of. Nothing to worry about. You'll be fine. It's not a big deal. If should you choose your mind, should you change your mind afterwards, you can always have it reversed, and it's really not a big deal. It's a business as usual procedure, and that's it.
Okay.
That's it.
We've come to the end of the show for today. I want to thank Dr. Abdulrahman and Zainab. Thank you for coming on the show. And for our viewers, thank you for watching up to this moment. And please, what's for doing here, please like, share, and subscribe to this channel. If you have any questions for Dr. and Zainab, you can drop it in the comment section to get there. Thank you. See you in the next episode. Bye.